In today's video, I had the pleasure of interviewing Dr. Laura Katz. Dr. Laura is a health, rehabilitation, and clinical psychologist. She received her master's and PhD from Queen's University and also completed her residency in London, Ontario. From 2016 to 2024, she was a psychologist at the Michael G. DeGroote Pain Clinic at McMaster University, where she helped to develop and run an interdisciplinary chronic pain program, along with providing individual and group therapy and assessments. In this role, she also did research, she taught, and provided supervision. More recently, Dr. Laura has co-founded Endometriosis 360 and is the lead psychologist along with being the director of health psychology at MindFit. She's also an assistant professor part-time in the Department of Psychiatry and Behavioral Neurosciences at McMaster University. Academically, Dr. Laura has published in peer-reviewed journals on the development and evaluation of her programs and been an invited speaker and provided workshops on these topics as well. In our interview, Dr. Laura and I spoke about psychological interventions for chronic pain conditions like endometriosis. We discussed the steps someone with endometriosis might take to process things like medical trauma and or learn to effectively manage pain and other bothersome symptoms of endometriosis. We discussed patterns from the mental health perspective that psychologists like Dr. Laura see correspond with endo and other chronic pain conditions like childhood trauma. And we discussed some useful techniques for nervous system dysregulation, which is very common in people with endometriosis and chronic pain conditions. I hope you enjoyed the interview as much as I did. Happy watching. Hi, Laura. Thank you so much for joining me today. I'm so excited to have you because you are specialized and an excellent person to talk to on a very unique topic that I think a lot of people in the endometriosis space don't know a lot about. So I'd love to start off this interview by just asking for a brief intro. Who are you? What makes you a great person to talk to on the subject of psychological intervention? Did I get that right?
You did. It's a big word, but it means something that we all know.
Yeah. I'd love for you to just give us a brief intro, who you are, what makes you a great person to talk to on this topic, and then we'll dig into the nitty-gritty on why this matters for endometriosis and chronic pelvic pain and all that good stuff.
Yeah, sounds like a plan. So, I am a clinical health and rehabilitation psychologist, and what that means is that I've done my master's and PhD in clinical psychology, and then I've registered with the College of Psychologists of Ontario so I can practice here. And what makes me unique is I've also claimed competency in the areas of health and rehabilitation. So what that means is not only do I have the mental health piece of being able to help people with conditions like depression, anxiety, and PTSD, but I also blend that into how individuals are coping with chronic health conditions, how their bodies and symptoms come into play, and all of that intermixed together. Sorry.
Yeah. No, that's okay. It looks like you wanted to say something else, but I wasn't sure if I should jump in there.
Let me just tell you a little bit more in terms of like examples. So given that background, I can really help people meet their goals. So those can be anything from helping them, take steps towards make big lifestyle change, or it could even be something like decreasing anxiety pre and post surgery to help with recovery. So, I kind of wear a lot of hats, both clinically, and I love to do lots of things like program development and evaluation, teaching, research, supervision, and so on. So lots of different things that I can help with within this sphere.
I love that. I was so excited to talk to you, Laura, because I don't know a lot about the mind-body connection, and I would just imagine that this is something that's very relevant for what you do. And I believe in the mind-body connection. I think it is huge. And I have seen time and time again that when we can decrease stress, when we can kind of work on that mental health side, it absolutely positively spills over into the physical pain side. So I guess my next question for you is, can you speak to research or your personal experience working in I'm assuming you're working with chronically ill patients, people who have endometriosis, chronic pelvic pain. So I'd be interested to know, about any research or personal experience on that mind-body connection in this space. That's sort of a generic question, but or a general question, I should say, rather. But yeah, I mean, I'm sure you can speak to it working and maybe give some examples. I don't know if that's a well-versed question there.
Yeah, absolutely.
Okay.
And so I could take you back to some of my research days. I don't want to age myself and talk about decades, but, I started researching and looking at, the mind-body connection back in undergrad days. And throughout my master's and PhD, I studied how women truly cope with chronic health conditions such as pelvic pain and interstitial cystitis and endometriosis. And we found that, this one factor of emotion regulation truly makes a huge difference, and not only, predicting whether or not women were adopting wellness-focused strategies for coping or illness-focused strategies, but also, how they live their life and whether they were thriving or really suffering, in terms of their overall disability and the level of impairments that they were experiencing. And so from that work, I was actually hired by a pain clinic at McMaster University, where I took those evidence-based factors and I was able to build a really innovative and cool interdisciplinary pelvic pain program that I have run for the past 8 years or so. And we were able to see such phenomenal results in these women in terms of patient-related outcomes and improving their mental health and well-being and getting them to function better and move better in their bodies. And so not only from an academic and research perspective, do we really understand that mind-body connection, but when you're clinically working with individuals, you can see the outcomes and how important it is. And like you were talking about, that nervous system approach, it's so important in terms of our functioning. And we often think about things that cause inflammation in the body, like we know the big ones, like stress and foods and, overdoing exercise or underdoing exercise. But some of the big things that sometimes we fail to recognize are our own cognitions and emotions can be very significant activators for our nervous system. And so within the literature, we're even starting to conceptualize, anxiety and low mood and depression as inflammatory conditions. And so that further speaks to, how far we're coming in the field of recognizing the importance of that mind-body connection.
That's incredible. Speaking of the nervous system, are there physical signs that people can look out for that might indicate to them that their nervous system is involved in this pain symptom picture?
Totally. That's exactly what I do as, a health psychologist. And so I like to work off the theory of window of tolerance. So essentially that middle window is where we want to be. We're like rational, healthy, nice people. We can respond normally. Our prefrontal cortex is online, which means that, we can be stressed out, but we can respond. But when our nervous system is overactivated, you're going to start to see symptoms like you're agitated and irritable, you're anxious and panicky, lots of physiological symptoms. Sometimes people feel like they need anger management because they just can't stop lashing out and it's really hard for them. Maybe your body feels like it's super, super reactive to everything in your environment. So creams, medications, treatments, your body just keeps reacting. And so this is when, our nervous systems are in that hyperactive state. But then also signs and symptoms that we see is sometimes people jump to the underactive state. So that's kind of when they're dissociated, shut down, checked out, lots of procrastination and avoidance and numbness, and really checking out of your body and what's going on. So, if you're noticing a lot of the symptoms both from the overactive or underactive part, that definitely would be something that your nervous system is likely in a state of dysregulation.
Interesting. Fascinating. What about sweating, excessive sweating, heart palpitations, physical signs like that also?
Yeah, all of those kind of symptoms. And so I would lump those under kind of panic symptoms because they're often very much related to being chronically stuck in that fight or flight state. So when you think about somebody being chased by a tiger, you get all of those kind of symptoms. You know, the blood is rushing to help protect you and to keep you fighting the tiger and running away. And it essentially is taking energy and body resources from doing things like digesting food, relaxing, sleeping, all of that. So all of that is definitely part of the picture as well.
I imagine you're probably seeing a lot of nervous system dysregulation in chronically ill patients, right? Because just living with chronic inflammation, just living with chronic pain, your nervous system is probably involved in that. I would just assume, right?
Absolutely. I mean, I can't say that it's like 100 to 0, but the majority of people that definitely come to me, it's usually because they've been struggling with something like this for so long. And then you kind of get in that cycle where, you know, because these things are happening and they're so bothersome, you become quite hypervigilant to them, which then jacks up your nervous system even more. And then you become more hypervigilant and you get kind of stuck in that chicken or egg cycle that just perpetuates over time.
Right. Okay, I think this is a nice segue. You had sent me some beautiful materials over to help me better understand what you do because it's so unique. And you had this document where you listed out that you help with certain program goals. And a lot of the language there really stuck out to me, like accepting the impact of a medical condition, learning effective ways to manage pain and bothersome symptoms, or processing medical trauma, which, oh my goodness, I think a lot of people in the endometriosis space know far too well. So I'm so curious to know how, like, what does it look like from start to finish? I mean, that's probably a really hard question to answer, and there's probably a lot of detail in there, but in as much information as possible, or as best as you can answer this question, how are your patients achieving these goals? Like, what does the starting point look like? What are some of these techniques that you use? Yeah, I'd love to dig into that a little bit more.
For sure. And I'll link back to one of your first questions in terms of what is psychological intervention, because all of that happens within the realm of psychological intervention. And so psychological intervention is essentially evidence-based therapy. And so it's quite structured, it's evidence-based, it's talk therapy. What makes it a little bit different than your typical counseling or supportive avenue is the fact that, you know, we're really focused on goals and outcomes, and it's based on a theoretical orientation to help people make real changes in their life that are associated with significant outcomes post-intervention. And so the orientations that I work from primarily are cognitive behavioral therapy, or CBT, and also motivational interviewing. And through those kinds of orientations, you know, I like to do a really, really good assessment because everybody's unique, everyone's different, you know, although, you know, everyone might have endometriosis or a particular abdominal or pelvic pain condition, you know, what got them there and how they're presenting, you know, can look so different from person to person. And so I like to ask lots of really good questions in terms of, you know, developmental history, psychosocial history, and mental health history, but also timeline and trajectory of symptoms so we can map all those things together. And through that, collaboratively, you know, with the client, I would come up with a really nice treatment plan that we'd work on together, particular to their goals. And so what that looks like is, to start, I like to begin all of my treatment programs with good quality psychoeducation in terms of the body, the nervous system, you know, what we were talking about earlier in terms of making those mind-body connections and making sure that they're buying into them and understanding why that's so important. And then kicking it off with, you know, some sessions on cognitive behavioral therapy, focusing on noticing what kind of cognitions and emotions are really driving that nervous system activation for that particular person, and helping them to both calm the nervous system when those things come up and shift their cognitions so their emotions might not be so intense or so strong or so negative. And then, of course, choosing some more effective and adaptive coping strategies and behaviors. And then the end part kind of looks differently for everybody. So maybe the individual, you know, needs a little bit of trauma-focused therapy. maybe they want to do some work on their body or healing their relationship with food. And then we kind of piece all of those things together. Of course, a lot of what I do, I make lots of interdisciplinary referrals because I think it's so important, particularly working with these conditions, to make sure that, it's not just the mental health piece, but making sure all the different pieces of the puzzle come together, and then the clinicians can collaboratively work with the individual to make sure that their goals are actually being met for true outcomes.
Excellent. Okay, I don't know if this is a question you can answer, but say I'm somebody living with endometriosis, I have chronic pelvic pain, it's really debilitating, sometimes I'll faint or pass out, or I'll lose control of my, my physical body because of how intense the pain is. So kind of what I'm envisioning in my mind is I'll kind of bring that to you. I'll say, this is a really traumatic experience for me. I've had these traumatic experiences over and over and over again for years. And then it sounds like through working with you, I'd learned to kind of better regulate my emotions and the thoughts that come with, okay, maybe my period is the high pain phase of my cycle. It's that part of my cycle where, those emotions start to ramp up, the nerves, the stress around my impending period start to ramp up. And so you're helping me kind of work through the thought process, the emotions involved in that. And then you have seen in your practice, as well as in the research, this translate to physical improvements in pain symptoms.
Absolutely. And so what you're describing is the fact that a lot of people start to get into these automatic patterns where, maybe once your period was so bad that you did pass out. But then, the next time you even got a cramp, your brain starts to jump to, oh my God, it's going to happen again. It's going to be so terrible, which jacks up your nervous system, in an adaptive way, because it's trying to, alert you, danger, you have to survive this. What do we have to do to get everything together to prepare for what's coming? And so that perpetuates over time that any symptom that you may be experiencing that might be similar to that, your brain and your body jump to that place and automatically try to prepare you. And so the work that you would do with me is recognizing and catching you, and we start to, deconstruct those kinds of thoughts, maybe shift them to more balanced and neutral and realistic things, work with the emotions. And again, I love to work with the body and other disciplines like physiotherapy, for example, do some somatic grounding work. So let's say you do experience that kind of pain. What can you do to ground yourself? What can you do to remind yourself, I'm safe, it's okay, I can tolerate this, I have skills to manage? And by doing, both the top-down approach, the cognitive stuff, and then the bottom-up, the somatic stuff, you piece those together, and we're really seeing some very significant results where people are able to experience pain but not be debilitated by it. And it totally changes, somebody's relationship and how they experience pain and what they do with it day to day.
That sounds so empowering. It sounds so empowering to be able to control your thoughts and your emotions and your nervous system and reclaim some quality of life by doing so. It sounds like it's a bit of a hard question to answer, in terms of some of those exercises. It sounds like there's a lot involved in the mind and the way that you process thoughts. So I feel like I would struggle to put into words what that looks like. Is it just talking, or are there special exercises? Sorry if I'm applying it. Probably
You're
not
walk me through a therapy session now.
Yeah, no, don't do that. But I'm
No.
trying to better understand. Yeah, I'm trying to better understand in my mind what that looks like. Yeah.
Absolutely. That's a great question. And those are the exact kinds of things that we actually do within our group program. And so, for those who are interested, I'll put a plug out there. We have developed this super innovative and cool 6-week intervention called Endometriosis 360. So it's myself and our co-founders are Emily Optoff, who's the registered dietitian, Jill Mueller, who's the physiotherapist, and of course, Dr. Matthew Leonardi, who's our medical director. And so all of these pieces that we're talking about, we put into this intervention. So follow along with us both on Instagram to see all of our reels, because essentially week by week we post reels and things about what we do, which are exactly what you're talking about. So I might post a reel and be like, we worked through some cognitive therapy this week, and this is what it sounds like. So it gives you a bit of an idea of the kind of things we do if you're interested. And so I use cognitive therapy. So essentially, I like to use something like an ABC model. So we look at, what's an activating event? What triggered it? Maybe it was waking up in bed and experiencing like a cramp. Maybe it was bending over and noticing, a particular sensation in your lower back. And then what kinds of beliefs and thoughts happen and occur after that trigger? Oh my God, it's happening again. And essentially, I like to really drill down and get to the meat of like, what's driving these kinds of cognitions? Like, why is that so scary for you? So maybe it would be like, it's happening again. And that might drill down to something like, if it's happening again, it means I'm not getting better. It means my treatment's not working. It means, what am I going to do with my life? It means I'm never going to be able to, start a family or get a job or whatever. And so it might start with just catching yourself at, oh my God, it's happening again. But we drill down to the meat of like, this is really driving anticipatory fear and anxiety about your future, and feelings of helplessness and worthlessness and all of that. And so the cognitive therapy piece helps you to restructure and change those kinds of thoughts, checking in with reality, how helpful are these kind of thoughts, and then we can maybe get into some more schema therapy in terms of like, where is this really coming from given earlier life experiences and relationships, and why are these kinds of thoughts and beliefs so challenging for you? And so big picture stuff, but it usually starts as something that's just a pang or a sensation or a what if, just a simple thought, and then helping you catch them and drilling down.
Yeah, that clarified it for me a lot. I appreciate that explanation. That's super helpful. Okay, so speaking of drilling down and early life experiences, are there any patterns from the mental health perspective you're seeing often correspond with an endometriosis diagnosis or a chronic pain diagnosis?
Absolutely. It's tricky because I always want to be cautious that, correlation does not equal causation. So
sure.
There is, we know from the literature, and it's been reported time and time again, that individuals with chronic pain, chronic pelvic pain, endometriosis, there is a history of trauma or early stressful life experiences. And I'm always pretty clear and careful not to say that those events caused your endometriosis, because we know that's not the case. And all that does is blame yourself and get you into more negativity. And so the reality is that when we experience early life adverse instances and histories of abuse or stressful things that happen earlier on, what it does is your body and your nervous system gets activated because it's fight or flight, and often that system stays chronically on for long periods of time. So that can lead to increased inflammation, chronic conditions long term, or if you have a surgery, difficulty recovering. And so essentially your nervous system gets into this state of central sensitization, and it's hypersensitized to all of these kinds of issues that might happen. And so we do notice that there is a lot of those kind of early histories. And that could be even things like, maybe you were a big worrier earlier on, and that's just the way your brain is wired. And so you've just went through life, being more of a worrier, and that's built up over time. Or maybe your mood is a little bit lower and you've struggled with that, and, self-esteem.
Yeah, and then it overlaps into the pain symptoms of your chronic inflammatory condition. Oh my goodness, I don't know if any of our listeners can relate, but and I love my parents. So just I want to preface by saying I don't have any hard feelings towards my parents, especially my dad, but he definitely grew up as a worrier, very, very anxious guy. And so there was a lot of yelling in my household growing up. And I always remembered, like, when I was in those high pain phases of my cycle, I would almost get this like stabbing sensation, and I would almost feel like my blood, like, the way your blood would boil when you're really angry, I almost felt like it would like travel into my pelvis. And then so even now in my 30s as an adult, I get that same reaction when I'm angry or when somebody's yelling at me or something. And so, yeah, I'm sure that there's there's a lot to do there with
Huge
my
connections,
childhood.
for
Yeah.
sure. You know what I mean? And like the fact that your blood flowed, like
Mhm.
that's an adaptive evolutionary response, right? Like
Interesting.
that happens for a reason because your
Yeah,
body is trying to protect you. And, you know, the majority of the time, parents are just doing the best they can, yours and mine included.
for sure.
But we start to develop this wiring, you know, and when that happens again and again and again, just like learning a new language or practicing, you know, a new instrument that you're learning, your body learns. And so it's now gotten to this place where when you're, you know, hearing yelling or you're stressed out, you might notice all the blood flow to your pelvis or
Mhm.
your pain signals being sensitized. And, you know, that's what's so powerful about having, you know, a really good quality psychologist or therapist, you know, within your care team, is they can help you notice and catch that and help to, you know, through different somatic exercises or cognitive exercises, help you to rewire. Like
Yeah.
all of that is just learning. And the same way that it's learned, it can be shifted and learned in a different way as well.
Yeah, I love that. When you said through all that material and I was looking through it, I was like, darn, this sounds really interesting and something that I could benefit from. So I might hit you up.
You should.
I think I will, honestly, because it's an area I haven't explored, and I'm confident that there's, you know, nervous system involvement in like my personal case. But for anybody watching, I will also link to the Endometriosis 360 program. So we definitely encourage you to check it out because it sounds incredible. I don't know, Laura, if this is a question that we've already touched on a little bit around. So we did talk about the nervous system dysregulation piece. Did you give us some examples of nervous system regulation?
Symptoms
Yeah.
or regulation. We've kind of already touched on it roundabout way in terms of like if your system is dysregulated. In terms of, you know, top down, you can do a lot of that cognitive therapy work, you know, counseling therapy, all of that.
Yeah.
And then bottom up in terms of the somatic therapy, you know, doing the body work, you know,
Right.
breathing, grounding, all of those kinds of things are going to help. And then piecing the two together.
Yeah, excellent. Yeah, and then you did give us some examples of some signs and symptoms that might indicate that nervous system involvement. Okay, so we did touch on that a little bit. Okay, so let's say somebody. Actually, I want to ask one thing before I ask this question. So, let's say you're somebody who's been living with endometriosis or chronic pelvic pain for many, many years, and you've tried a lot of these conventional strategies. Maybe you've had surgery, maybe you've tried some kind of hormone therapy, you've tried the diet approach, and maybe you are seeing improvements along the way with all of these strategies. Is there like a point in this journey where you might go, okay, I've tried all of these things and now I'm going to move into the psychological intervention space? Or do all of these things work together? Would you recommend that, you know, while you're doing all of these other things, tack on that psychological intervention? Is there like a better or worse time? I don't know if my question's coming across the way that I want it to, but that's kind of what I'm asking.
I get it. So
Yeah.
when it's helpful for psychology to be involved?
Yeah.
And I mean, it's a little bit tricky because I think psychology should always be involved in
Sure.
everything.
Yeah, I figured that
I mean,
was going
like
to be the
families
answer.
should have psychology. We should learn psychology in elementary school, in university. Like we should learn taxes and psychology, you know, throughout our lives to better prepare us
agree.
for this world.
I agree. I
But
totally
you know, in terms of your care plan, psychology can be so helpful in so many different ways. So as a health psychologist, for example, it might be preventative. So it doesn't even necessarily have to come to the point of disease. So I work with lots of individuals where they get their physical and then they also see their psychologist just to check in terms of like what's going on, how's their mood and anxiety, what kind of behavior goals do they have and how can I help them? It could be any time throughout, you know, their medical journey. You know, I can help people cope with, you know, all of the uncertainty that's associated with lots of doctors and tests and investigations and the anticipation associated with that, pre and post procedures, helping people with recovery and, you know, getting them back on track. But also in the sense that, you know, sometimes, you know, an individual, like you've been through it all. You've seen all the doctors, you've done the surgery, you've done all the tests. And sometimes people get the sense that they're kind of done. They've experienced so much medical trauma. They're just ready for their journey to start to take a different path. And I can definitely help people with that headspace to see where they're at, what they're willing to accept, what they want to change, and what that acceptance might look like for them in terms of their next steps and how to feel more comfortable with that in their lives. And you said something that's really interesting before that I want to capitalize on, is having a psychologist or a really good quality therapist on your team can help you with that self-efficacy. So it really does put you back in the power seat and gives you the confidence that you can cope with this and you do have skills to manage, and your future isn't hopeless, it's hopeful and can be associated with really positive emotions for you feeling, efficacious in your journey and your next steps in your life.
Yeah, I love that. And I can 100% attest to clients who work with me on the diet side who are also seeing somebody for that will help them with psychological intervention as well as like pelvic floor physio. They really do so much better. They really do, like, it's incredible, their transformation. So yeah, I agree. Definitely having a team is helpful. Okay, so if somebody was interested, maybe this is the first time they're hearing about psychological intervention, seeing a psychologist for chronic pelvic pain for endometriosis, where do they start? What does that look like? Do they come straight to you? Like, what does that look like? Yeah.
It's, so I'm a bit of a unicorn, but there's definitely very good people out there who do very, very similar kinds of work. So I would definitely recommend looking for a therapist or psychologist. So if you're looking for a psychologist, somebody who has a health or rehab background, because they're going to understand the mind-body connection and coping with chronic pain and illness. In terms of therapists, there's all sorts of different, qualifications and so on, but ideally looking for somebody who understands pain and chronic health issues and maybe does some trauma and somatic work as well. That's probably going to be a really good fit. In terms of me and my practices, I work out of a private practice called MindFit, and we are building up our health psychology division, and we have a few of us there that do very similar types of work. So just want to do a shout out to them. And then also, as we've talked about, our Endometriosis 360 program. What's really nice and unique about our program is the fact that from the moment that you step in, we get you. Like, we want to know you as a person. You don't have to explain. You're not looking for validation. We believe your symptoms. And so you can kind of hit the ground running. And every time you meet with us, you're meeting with us together. So it's not like you have a therapist here and then a physio there. And then, you're not trying to be your own health advocate. We are there all together, helping you meet your collaborative goals. And there really is something so beautiful and magical about group programs because, we know the literature and the data, the fact that group programs are effective, they work, and the symptoms last over time. But it's really something beautiful about joining a community of other women who are in such a similar space and then growing and learning skills and strategies together. I find, on social media and the internet, a lot of times, peer support groups tend to be, on the negative side, or they might make you feel helpless at times. And what we're really cautious about is mediating, these kinds of programs to make sure that everyone is supportive and it's a positive experience and you're building each other up. So in terms of group therapy, we know that the parts equal more. And so you get to see all of these beautiful results, within that group intervention and therapeutically as well.
I love that. And you're hitting off all those key areas. You got a dietitian, got the mental health side, the pelvic floor side. And then Dr. Leonardi, is he offering advice on surgery, on, I don't know what, like, I've interviewed Dr. Leonardi a few times. We're quite well connected online as well. what is his role in the program?
So yes, Dr. Matthew Leonardi, we are so excited to have him as our medical director. And he is a huge part of our program in terms of its development
I see.
and also how it's running and everything. And we're constantly always chatting together about ideas. And so for our first group, we were lucky enough to have him join one of our group sessions where, he was able to provide Q&A about lots of questions, anything that you don't get to have answered within the 15-minute slot you get during an appointment or so on. And so anything and everything. So he's definitely a part, and his role is going to ebb and flow and change as our program grows. But he's definitely, really on board in terms of our growth and development of the programming.
Yeah, excellent. I love that. It sounds fantastic. It really does. It sounds like an incredible program. Okay, excellent. So I think we covered all of my big questions here. Did you have any final tips or any nuggets of information, any takeaways for anybody watching who's new to this, who maybe wants to explore it, has some hesitation?
Yeah, I think that, in terms of involving mental health and psychology, sometimes it can be scary because it's something that maybe you've always pushed aside or you don't want to think about because it's uncomfortable. And, in working with lots of individuals and also what we know from the research is the worst it ever is before you actually start the work. So however scared you feel is the most scared you're going to be, because once you actually get in there and start working through things, all the pieces start to come together, and it really does feel so holistic, and you start to see the results. So don't necessarily feel trepidatious or scared of taking that first step. And I really want to, again, push that nervous system piece where we do so much for the body in terms of the food we put in and the movement and all these things that we take care. And your thoughts and your emotions are just in this important piece in that mind-body connection. And so if you're not taking notice of that and you're not really aware of that impact on your whole system, it's going to be just as challenging and just as activating as many other things that we do. And so just one final plug to pay attention to the mental health in terms of how important it is for that mind-body connection.
Oh gosh, I agree. That's a great way to end off. It did come back to me, the thing I was going to say before, and it was about and you had alluded to this previously in the conversation around food fear, maybe a bit of disordered eating. And so, as an allied healthcare professional, a dietitian working in the space, I see a lot of that. There's a lot of fear messaging around food. And I'm sure that that's also a part of what you support people with from the mental health side, right?
Yeah, absolutely.
Excellent. Okay, great. Well, thank you so much. I think that was a fantastic way to end our interview. And I just, again, wanted to thank you so much for your time. You are a wealth of knowledge. I learned a lot from you, and I'm positive that our audience will learn a lot as well. So thank you so much.
Thank you. It's been great to chat.
Thank you so much for tuning into this interview. If you haven't already, please like this video, share it with a friend, and hit that subscribe button for more endometriosis and fertility content. And I will see you in the next video.